get started in about a minute. I'll just encourage everybody to mute their computers for the time being. And then you're more than welcome to have your video on since we can see your faces. While we're waiting for everybody to gather, because I think we are waiting for a couple more people, why don't we do in the chat, everybody can write your name, your profession, and what brought you here. That's great. Thank you, Alicia. Awesome, Natalie. Thank you for being here. Sam, thank you so much. This is really fun. This is a room full of so many of my favorite people. Yes, thank you, Emily. Awesome. Thanks for being here, Megan. Great. Thank you, Robin. All right. What do you think, Jess? Should we get started?
Let's do it.
Okay. So my name is Sarah Gormley. I think just about everybody in here, which is wonderful. I'm a labor doula, a childbirth educator, and a perinatal yoga teacher. I began kind of my birth work experience as a trauma-informed yoga teacher, and I've carried that trauma-informed lens into my work as a birth professional. So I founded the Atlanta Birth Project, which is hosting this event, and I'm really excited to talk to you guys.
And hi, everyone. I am Dr. Jessica Goodnight. I'm a clinical psychologist. I own my private practice, the Anxiety and Trauma Clinic of Atlanta, and I am a PTSD and anxiety specialist with a particular interest in women's issues, sexual trauma, birth trauma, and things like that. And so I'm really excited to share what information I have on using kind of a trauma-informed lens to help people through this impossible time.
I am really quickly just gonna send this login information to Gina so that she can get on with us, and then I will get going. 2 seconds. Gina, by any chance? Let's see. All right.
Hi, Sarah. It is Gina.
Oh, good. Okay, good. I was just texting you to say I emailed you.
But I must be logged in on our Zoom.
All right, so we're gonna get started. Please feel free as we're talking to introduce yourself in the chat box. Otherwise, if you can mute your microphone for now, that will help us to not have the screen kind of jumping back and forth. So we'll talk about why a trauma-informed approach is needed right now and why it can be really useful. As some of you guys might know, according to the National Intimate Partner and Sexual Violence Survey, 1 in 3 women experience sexual violence, 1 in 5 women are raped. Many doulas know that oftentimes women seek doula support because they've had a traumatic first birth experience. And then we also know that women of color birth under racism and systemic violence that is at the heart of our nation's maternal mortality crisis. So lots of different reasons why women might have a past history of trauma and might be coming into their birth experiences with trauma, and a particular need for trauma-informed support. So you might consider some potentially triggering aspects of childbirth in our normal childbirth experience, but a lot of these are really being exacerbated right now by the COVID environment. So these might be all of the unknowns that women are facing, the constantly changing rules and restrictions, and the power dynamics of the patient caregiver relationship that might make the receiving of these new rules and restrictions that much more challenging. And then, of course, the possibility of not having your doula or maybe even birth partner present with you, that could be really challenging for any women, all women, and especially trauma survivors. So regardless of whether or not your client discloses past trauma, we know that a trauma-informed approach supports the physiological process of childbirth, and it can be helpful for empowering your client within their birth experience. So trauma-informed care equips professionals with specific tools and techniques for supporting and empowering trauma survivors throughout their childbirth experience. Jess and I will be offering a more comprehensive trauma-informed training program that provides really specific evidence-based techniques for each of the 3 tenets of trauma-informed birth support that we have put together. So for now, we're going to go through these 3 tenets of trauma-informed birth support. And we think that they're really useful to guide the conversations that you're having right now, to sort of use them as benchmarks, maybe to come back to when you're having these difficult conversations and you're not really sure what the right thing to say is. So Jess is going to start to talk through these 3 tenets and how they can help guide your conversations.
Hi, everyone. So there are a lot of models out there of what trauma-informed care is, what the tenets of trauma-informed care are. And sometimes there are, 8 different tenets of trauma-informed care can be a little bit hard to wrap your head around in a moment-to-moment interaction with clients. We've distilled down our understanding of trauma-informed care into 3 tenets of the care that we think you can offer that would be trauma-informed. And those 3 are safety, autonomy, and resilience. Supporting safety, autonomy, and resilience in the perinatal period as we are preparing your clients to give birth right now. If you guide your conversations according to those 3 tenets, you may be able to provide a little bit more of that trauma-informed care and give people a little bit more of a sense of safety, autonomy, and resilience while they're approaching something that is going to be genuinely challenging. So the first one is safety. So when we think about safety in trauma, we think about physical safety being really important. Right now, physical safety is a lot of what's on people's mind when we're thinking about contracting a virus. So in addition to physical safety, we also want to support emotional safety. Somebody feeling like in that moment, their needs are going to be taken care of. In that moment, they're not going to be sort of emotionally unsafe, something unpredictable happens. So how can I support this trauma survivor in achieving the maximum level of physical and emotional safety in their prenatal care and in their birth experience? Sort of one way to guide this conversation, thinking to yourself and considering, in what way can I support this survivor's physical and emotional safety? In what way can I give them the maximum access to what they need to feel both physically and emotionally safe? Both preventing actually spreading COVID and and giving them the sense that they're going to be in a safe environment, but also that emotionally unsafe things, like that they're prepared if something emotionally unsafe might actually happen. like a woman contracting COVID and being separated from her newborn. I know a lot of women are preparing, heard stories about that and are scared about that right now. And so giving the absolute most information so survivors know what they're preparing for is a way to support that physical and emotional safety. So the question kind of guiding that conversation is, in what way can I support the physical and emotional safety? For autonomy, when working with trauma survivors, it helps a lot with healing if they're approaching triggering situations with a sense that they chose to walk into that situation. When a survivor knows that they're about to approach something that is really frightening or triggering of a past traumatic experience, they may well be able to do that. But it is important that they have that sense that I, at the very most, kind of at the most possible, had the choice to approach that situation, had the power to choose whether or not they could do it, whether or not that was something that they had to do. Right now, that's really challenging because survivors are approaching situations where they maybe have kind of preferred a different birth plan than the one they might be forced into by hospital policies. So consider, in what way can I give the survivor the absolute maximum amount of choices? In what way can I give them choices if they are having a reaction that their autonomy has been taken? And in what way can I give them more options so that they can at least choose between one kind of plan and another, giving evidence-based suggestions, but trying to give even the suggestions, like, offering information about how to change, even where you're giving birth or transferring care, is a way to support autonomy right now. And the last one is resilience. So the question to sort of ask yourself when you're wanting to make sure that resilience is a part of this conversation is, what resilience and coping skill does this survivor already have? Does this person need more resources and support in order to be resilient? Many trauma survivors are resilient. Actually, the most common reaction to trauma is resilience. So when someone is, sort of needing a trauma-informed approach, that doesn't mean they don't have a lot of coping skills and a lot of resilience factors, and they may be actually able to access those just fine right now. Or maybe they need some additional resources and support in order to access the resilience and coping skills they already have. But it is important to note that one shouldn't expect survivors to necessarily even be struggling as much. Wait until the survivor tells you that they need some support, and then you can provide that. So if you're kind of interacting with somebody with a lot of fear and anxiety and assuming they're going to be really upset about the change that they're going to be facing, that may not be the message that helps somebody who has a trauma background, because they actually may have been very prepared to be flexible and resilient in the face of whatever kind of change or hospital policy they have to deal with, or whatever it is that whatever information it is that you're having to share with them, assuming that they probably will be resilient, but maybe they might need some resources and support, tends to be actually more trauma informed, assuming that the survivor has everything they need. Or maybe needs just a little bit of resources and support, and only giving as much as this person does need from you as a birth worker. So again, the questions to ask yourself to support safety, autonomy, and resilience are, in what ways can I support the survivor's physical and emotional safety? Can I give the survivor more choices if they feel their autonomy has been limited? And what resilience and coping skills does the survivor already have? And does this person need more resources and support in order to be resilient?
Awesome. So I'm going to take a second just to talk to you guys as a doula about some of the ways in which I have brought these into my prenatal conversations. So for safety, one of the questions that I've been using, and I really like to ask this with a partner present, ideally the partner that's going to be with a mom in labor, is how do you feel emotionally safe? And it's a good question to kind of get a conversation going about what scenarios and what feelings in your body do you have when you feel like you're emotionally supported. For a partner to hear this and for them to write that down and kind of discuss it together can be a good starting place for emotional safety. For autonomy, the main thing that I've been doing for this is connection to local resources. So I sent out an email with just 2 kind of basic resources, but I'm sure I know in a lot of the Facebook groups that I know all of us are in, there are a lot of good resources, ACOG, evidence-based birth, that are kind of being passed around around what's going on right now, up-to-date evidence-based information. Doulas are already so good at this. Doulas are so good at all of this, but it's just I think it's a really helpful thing to do to start to organize around a trauma-informed structure. So, and then for resilience, I've been focusing on client-led affirmations. So Jess has helped me as a trauma professional to understand that affirmations only work when they ring true to the person who's speaking them. So these affirmations need to be client-led, otherwise they're not going to feel supportive and they're not going to build resilience in your client. So having a conversation about what affirmations really feel right in their bodies can be really helpful. The Birth Center, thank you Sam and Anjali, Instagrammed a really great list of affirmations that really did support resilience right now. It's on their Instagram, so I recommend referencing that. 3 that I've had come up for clients in conversations that I've been having are: my body knows how to birth, I have prepared beautifully for childbirth, and I will bring my baby into the world. And these are all client-led. The other thing that I want to help connect you guys for building resilience are resources for informing and educating birth partners. So many women are navigating the possibility of not having their doula with them in labor. So I know that a lot of doulas are trying to kind of doula the birth partner right now. So we have some amazing educators here in class who are doing this. Birthing from Within Atlanta is offering a free class, I believe today. Maybe, yeah. Pam and Gina could maybe post about that in the chat if they wanted to connect a free class for birth partners.
5 o'clock today, Sarah.
5 o'clock.
5 o'clock. Thank you.
Thank you so much. So I've been sending that information to all of my clients to make sure that birth partners feel like they have a really good sense of what a doula does and how they might be able to implement some of that in a birth. And then supporting her is a really great resource, started by an Atlanta-based doula, and she is offering I'll send out the information on this. She's offering a big discount right now on those classes. I think it's like 50% off for supporting her classes, and she's even sent me a link for, I think, some free classes. So I'll send that out. But again, that's a birth education model that's really focused on empowering the birth partner to be present. All right, so does anyone have any questions right now about the 3 tenets or anything that's coming up for you guys right now before we move into the next section? Okay, we'll go ahead and move into a skill that we believe will be helpful for you guys right now.
So in my clinical work, I've worked a lot with trauma survivors, and I work a lot kind of in resolving trauma, in helping people process past traumatic experiences in order to be resilient. And at the same time, many times trauma survivors are approaching situations that are they're sort of unprepared for, either in that it's a situation that's beyond where we're at in our work, but they just got to do it. Actually going into childbirth before they've actually processed a traumatic experience that they expect is going to kind of come up for them, or they're about to see a family member who, may trigger, those memories and past trauma. And when it's sort of an impossible situation, that it's going to bring up some difficult emotions, some really challenging, triggering experiences. I really like using a skill called cope ahead. So has everybody gotten Sarah emailed everybody a worksheet that we created together. Has anybody not gotten that? If you haven't gotten it, do you mind putting your email in the comments so that Sarah can email you the worksheet? Because I'm going to be going over that. So basically, when we know we're about to approach a situation that's going to bring up really difficult negative emotions, it's really helpful to prepare in advance to cope well with that situation in an actual visceral way. So not just, what skills will I use and planning up in your head, but actually planning in your body and planning actually with a full sort of imagining experience. So coping ahead is actually imagining that the thing that you fear, the thing that you're about to approach, is about as bad as it's reasonably expected to be. And then preparing as though that situation does come to light, and that you prepare and that you actually imagine coping well with that situation if it does happen. So this worksheet is something that you could actually either give to a client and say, you could work with this with me or on your own. It's up to you, but I wanted to give you this resource. Or you could work with them sort of back and forth in that moment and work through this worksheet. So let me go over that. So at the top here, it's saying, okay, before you start, ask yourself, are you in a reasonably calm state of mind? One where you feel ready to consider the ways your birth might not go according to plan. So when a survivor's sort of considering, okay, wait, how's this going to affect my birth plan? Like, is everything going to go wrong? And if it does, then what then? And that may be pretty overwhelming. And so in the moment that's really overwhelming, all the things that might go wrong, that's not the time to do this work. The time to do this work is when you're like, okay, it might not go according to my birth plan, but I'm not overwhelmed by that in this moment. That may be overwhelming if it does happen, but right now imagining that it's not overwhelming, that's the time that this would actually be helpful. It's really hard to plan for something that's already overwhelming you. So this exercise might bring up some difficult thoughts and feelings. So if you're working with somebody on this, it should really be something that they've chosen to do. So you can hand this to them and you could say, hey, like if this is something you're sort of feeling like you could do, I could do this with you, or you could do it on your own at some other time when you feel sort of ready for it. So once you're sort of, if you've got somebody in front of you who's saying, yeah, like, what are you talking about? I'll do the worksheet that you're talking about. Then you can sort of go from there and ask, them to take some time and consider the ways that they're thinking their birth plan might not go the way they expected. That might be a pretty challenging conversation. Some might be sort of hoping that it doesn't go wrong, that things don't go the way that they fear. If they're not ready to do that, don't make them. This is really something that is client-led. But if they're sort of thinking, yeah, I'm afraid that I'm not going to have my doula, and then I'm not going to be able to handle the pain, and then I have to get an epidural, and then, right, what if I end up having a C-section, and how am I going to feel? If someone's really already there and thinking through all those scenarios, you could write out, okay, so you're afraid, that you'll have a C-section, you're afraid you won't be able to handle the pain, you're afraid that you're going to be alone, kind of helping them think through what about their birth plan not going according to the way they had wanted it to, what part of that is really hard and scary. So that they're thinking through all the aspects of that that might actually be triggering or anxiety provoking. And doing this isn't harmful. What you're doing is helping somebody write out what's already on their minds. So people are already anxious about these things. They're already thinking about these things. So guiding them to sort of detail it out tends to be, maybe in that moment would bring up some difficult thoughts and feelings, but actually helps because it's already on their mind anyway. So once it's out on paper, it tends to be just better organized and better processed. then kind of guiding a survivor thinking through, okay, like, okay, you're afraid that will happen. You're afraid this will happen. And we don't know. We don't know if, something will go wrong. We don't know if, if somebody's having a birth later on. We don't know if doulas are going to be allowed in the hospital at that point. We don't know. And so, okay, if that happens, what skills, what is the resilience you already have that you can bring to this situation? What are the skills you already have used to cope well with the situation? And we have a checklist here of different things that many people already have done or already could do when they're preparing to give birth. So, maybe they could remember what a loved one has told them at times where they've really been struggling. Or maybe they could, use their hypnobirthing for those who have been doing hypnobirthing. Or maybe they could use positive affirmations if they've identified certain ones for themselves that do ring true and feel sort of grounding and centering. So thinking through all the skills they already have. And sometimes survivors are surprised, like, oh yeah, I do have actually a lot of things that that I've done when I'm really struggling that I could use in that moment. And so really the key part is this next bit. Now that they've identified, okay, what are you afraid of? And then what are the skills you could use? What really works about this skill is encouraging them on their own to actually, in as much as they can, to really imagine, close their eyes and really picture the birth they don't want. And this is not something they have to do with you, but this is something to, encourage them to do. Because imagining the birth they don't want and then imagining coping well with it will, likelihood is, prevent that birth from being traumatic if it doesn't go according to plan. This is a birth I'm already ready for. This is a birth I've already prepared for. This is a birth I've rehearsed in my mind. And yes, it's not what I wanted, but I am ready for this. I'm prepared for this. And this isn't a surprise. It's not something that blindsides me. A lot of trauma is about an experience being a shock to the system, something I wasn't prepared for, something I wasn't ready for, and something I don't think I can cope well with. So actually imagining and fully preparing and imagining the birth I don't want happening and I cope well with it will really help a survivor be ready for that birth they don't want. This is really hard. This is really hard to do, and it's something that that is why at the beginning you really want somebody to be in a place where they feel really prepared to consider the ways their birth might not go according to plan and feel what feelings show up when they think about that. So, fully imagining the birth they don't want may bring up some intense emotions, but that is okay. That doesn't mean they did the skill wrong. That doesn't mean that that this exercise is harmful in any way. Preparing for the birth they don't want ought to prevent. It's almost like an inoculation to preventing that birth from being traumatic if it does happen. Because this is challenging, the end of this skill is encouraging people to take really good care of themselves in every way that they use self-care, taking a bath or going on a walk, or maybe doing some stretching or breathing exercises, going really easy on themselves after this. If somebody's very anxious about a birth they don't want, doing a lot of practice of this tends to be really helpful. A lot of practice of, okay, it's a birth I don't want, but I would cope well with it. Okay, it's the birth I don't want, but I cope well with it. This is something that I do with people as a therapist, but people who can't access therapy or lower level of severity can very easily do this on their own. It's not very complicated. It's just imagining in as much detail as you can the birth I don't want and coping well. And so this is it's a handout that Sarah and I created that is something to share with people who are scared that what they're facing is the birth they don't want. And to the most we can do, the most you can do, giving them the birth they do want is what you want to do. But, in these times, we're talking about situations where people may very much so be forced into a situation where they aren't getting the care that they had hoped for. And that's what this is for.
The two other things that I just want to add in, kind of merging the COPA head skill into childbirth preparation and care. Two things that I see being really valuable are setting a boundary for the COPA head skill versus your daily life and your daily preparations for childbirth, so that you can return to positive affirmations and positive messaging around birth, right? So your client should be prepared to set a time and a space, maybe light a candle, and do the COPA head skill in a way that doesn't so easily bleed into the way that they're regularly preparing for childbirth. The second thing is to encourage your client to gather your birth team together, maybe after going through the COPA head skill. So making sure that if you're a doula, you're communicating that you're available, whether the client does this with you or separately, for a phone call afterwards to process how it went. If your birth team, or if your client regularly sees a therapist, maybe it might be useful to encourage them to have the therapist, an appointment made so that they can process anything that might have come up with their therapist afterwards, or their partner. If you're talking about the COPA head skill in a prenatal consultation and the partner's there, making the partner aware that this might bring up some difficult things for the birthing person, and that there should be some time to process afterwards. Jess, do you have anything else to add?
I think I probably emphasized this already, and maybe I'm overemphasizing this, but this should be something that is client-led, is probably the message that I want to get across the most. Sometimes people are just not going to be in a place where they want to do this or are ready to do this, or maybe ever want to do this, and that is okay. This is something that tends to be helpful if people think they have a need to prepare for something that's coming their way. It's something to hand out, and something that I found pretty effective across the board. But I would know, I've had a lot of mental health training in when to introduce something like this, and that's sort of a delicate thing. People are going to be able to tell you and choose for themselves whether this is going to be helpful for them or not. For anybody who, is a birth professional or doesn't have mental health, a lot of mental health training and background, I wouldn't suggest, telling someone this is something you really need to do, if there's any pushback at all. But it's a resource to offer to people if they're thinking, I don't even know how to, what if it does go wrong, and what am I going to do? It's something to offer to people who are sort of there.
And if it doesn't seem like the COPA head skill is the right thing to do in that moment, or maybe at all for that client, then you have the 3 tenets to come back to. And Jess and I are really excited to, in the future, offer more resources around those 3 tenets that would be more applicable at different stages in kind of a birthing person's birth experience. So
yeah, I think.
Oh, sorry. Go ahead, Jess.
What were you going to say? I was just saying, I think, one thing that I'm really excited is talking through how to support autonomy when you're having conversations where, someone actually might be sort of forced into a decision, or you might have certain boundaries as a professional where you can't give somebody exactly what they're asking for. And how do you have conversations that support autonomy to the best of your ability when you're working with somebody who's frightened, or somebody who's been through a past trauma that they're trying to sort of contain in a birth experience. There's a lot of education I'm excited about working with Sarah Gormley on, and how does one have a conversation that supports autonomy, when you're working with somebody. So I'm pretty excited about that.
So if you guys are interested in that, I have everybody's email addresses. So maybe just send me a message if you're not comfortable with being put onto a list for updates on when that training will be offered. So just let me know if you're not comfortable with that. Otherwise, I'm going to go ahead and put these email addresses on our subscribers list for the Atlanta Birth Project. But I'd love to open it up now because we have some time and see maybe just to discuss some of the things that you guys are encountering in your prenatal conversations. And maybe if you'd like any clarification on any of the things that we went through today.
I'll go. It's fine. Yeah. So I have a client now who definitely has some pre-existing anxiety challenges and has been seeing a therapist regularly. And I broached the subject this week about, the potential of serving as or giving virtual support for her as her doula. We had a conversation about it. I told her, I just wanted to keep the lines of communication open as I have 2 children at home. And, there are just a lot of different factors to consider during this time. And so essentially it sent her into a bit of a tailspin. And when we reconnected the following day, I assured her that, the support is still there. We're just looking at exploring some other options at this time, given the circumstances and really just the state of our world. So in understanding that this needs to be a client-led exercise and conversation, I'm wondering if she's not, and to me, I would say she's probably not ready to go this route. She wasn't really open to the virtual thing. She really feels like she needs the physical support, which I intend to offer her, provide her with. But is there anything else in a situation like this that can be done to kind of ease the anxiety and ease the trauma, but for somebody who might not yet be ready to have this conversation? Because I still think there still needs to be some level of support. And then I'm struggling myself because I did have a client that was open to the virtual support and it went really well. So I guess my question is twofold. How do we support somebody who you recognize needs a certain level of support but isn't ready to have this conversation? And then I'm just interested in what is the conversation about birth workers protecting themselves at this time, and some of the challenges that we're experiencing as a result of that. Loaded, I know.
Jess, you want to take the first and I can take the second?
Yeah, that's exactly. I was going to say, I don't think I can speak to the second. But the first is, I think when people first are hearing that from you, I really think of grief as being the model to use here. This is somebody who had a birth plan in mind, had an idea of how things were going to go, and then they are not going to go that way. And it's sort of not your responsibility to completely save her from the grief that's going to bring up. It's one way that you could think about that is thinking, if somebody was experiencing grief, how would I approach them in that case? Providing validation. This is awful. I know you had something else in mind. I know this isn't what you hoped for. And maybe they're not even ready for that from you, depending on the person. But it's not going to be something that you can do the best you can in providing validation. You're right. This isn't what any of us imagined. You're right. Screw this virus. I really wish this wasn't the way that that the world is right now. You can kind of hold your boundaries if it's something where you could, but you're worried about your kids or or immunocompromised or something it's I have certain boundaries and this is one where I can't, but I'll give you as many choices as I can within my boundaries, but I understand that hurts. I understand that sucks, is the probably about the most you could do for somebody. If somebody's in a true anxiety tailspin, it might be helpful to provide a therapy referral, but maybe with good timing, for, after, like, listen, I know this is making you really anxious. Let me know, if I know some good therapists and I can connect you to somebody. If this is just so overwhelming, like I know some good people, but I understand why this has really thrown you. So that's what I would suggest as a mental health provider.
Thank you.
So in terms of the doula aspect of it, one of the things that really came up for me when Jess was talking is, if someone is grieving, many of us might be familiar with grief and know that when there's someone who's constantly trying to fix it, that doesn't necessarily help, right? So I think framing it that way as doulas is a good way to frame the support we're giving, and also take care of ourselves and our own mental health and our own, physical safety and that of our families. Understanding that it is not our job as doulas to fix what is happening right now, right? It is our job to provide resources and provide emotional support as much as makes sense for our own boundaries. So maybe I know that every doula has a different opinion right now, and it's changing every day in terms of what the right thing is to do with providing virtual versus physical support. I personally think that it's a personal choice that should be respected as a personal choice and not like a professional requirement. I would like to see some like a general. I'd like to see that embodied in these conversations, is like a respect for everyone's individual decisions personally. But I think the other maybe useful thing that also just kept on coming up for me when Jess was talking was recognizing your scope of practice, right? In trauma-informed care, when Jess and I do our more comprehensive training, scope of practice is going to be a big part of that. When you're working with trauma survivors, what's your scope? Where does it start? Where does it end? And making sure that doulas in Atlanta are really fully equipped with the resources that they need, so that care doesn't drop off when your scope ends and another's begins. So that's probably another thing to think about right now. We're excited to be offering a fuller resource list, but maybe individually going onto those Facebook groups and putting together kind of really like filling out your resource list that you're giving clients right now, and making sure that they have all the options and resources that our community, because our community is incredible here in Atlanta, just to see what's being created. I hope that's.
Can I ask a question?
Yeah.
Okay, this is Anjali Hinman, certified nurse midwife at Atlanta Birth Center. Thank you, Jessica, and thank you so much for hosting this for all of us. This definitely feels like a time of grief, loss, and trauma for sure. Even for people who don't have a history of that at all, right? It's a societal grieving that we're all going through right now. I know that as, a director at our practice, things are changing on a daily basis. As we learn more about the virus, as we learn more about the impact in our supplies and all of these things and how we can protect our families, but also protect us, because if we get sick, then there will be no midwives, there will be no doctors, there will be no nurses, and women will be unattended. And I mean, this is like worst case scenario, but we have to consider that that's a possibility and planning and such. So part of PPE, right, personal protective equipment for healthcare workers. And so really struggling and working with out-of-hospital providers about what is appropriate, what is needed, and what's available. And so I will tell you that, we will be using some type of personal protective equipment at our births, even at the birth center. I don't know exactly at this moment, but by the end of today and by Monday, we'll be wearing masks, and that can seem really scary to someone, right? Like they're having their support people stripped away. They're having these midwives that they were used to come in with these masks and wanting to stay away from them as much as possible, like 6 feet away. And, then the idea of going to the hospital and what that will look like. And it's just so much, but they're also necessary for the protection of all. And so I want to know what suggestions the both of you have around how we can best prepare and not make that piece of it, the actual like mask and goggles and all of that, seem traumatic and scary and impersonal, you know, besides of course the like talking about it beforehand and expectations. And we have a picture of one of our midwives wearing the mask that we already put out in an email. We'll kind of print that up in a, you know, a framed thing that we'll have up, you know, for people to see, although we're trying to do as much of our clinic encounters telehealth as much as possible, but some things do need to be in person. So that's one question that I have for you guys, is about that.
Thank you so much, Ashley. Yeah, you want to go first, Jess?
I just, what you did, putting so your idea of putting, you know, a picture of a midwife in a mask, absolutely everything you can to make it very normal now, is what I would suggest, you know, like having a really good connection over, even, this might seem silly, but even like a midwife trying on the mask in a telehealth session and just being like, look, like I might look like this, but I still care about you. Let's have our interaction this way, just so you get used to it. Might be one way to help somebody be like, oh, I can still, you know, have a heartfelt discussion with a midwife while they're wearing a mask, you know, oh, this doesn't have to be interpersonally disconnected. If somebody can learn that, not just by talking about that, but actually learn it with experience, that tends to help in those moments when everything's chaotic, like labor, and like, oh, but I know this is familiar to me, you know, that tends to help with somebody who's approaching a potentially triggering situation like you're describing.
Yeah, that's very similar to what I was going to say. I was going to say that I think using the cope-ahead skill for something like this would be really useful, and sharing. I'm just so glad you shared this with so many doulas and childbirth educators in this like virtual room, because that wasn't really something that I've been preparing my clients for, and that's a really good conversation to be having with your clients right now. Is, you know, your friendly midwife OB might look like this, and maybe using the cope-ahead skill to prepare for what that might feel like. The other thing that just has been coming up for me in my conversations, and that I thought of when you were talking, Anjali, is that I think it's helpful to emphasize with clients that during this time, you can know that something is medically necessary and you can still be uncomfortable about it, right? So I think a lot of very resilient birthing people right now are telling themselves, this is just the way it has to be. Like, this is what's best for everybody. I've had doula clients who like immediately in a phone call are like, yep, we get it. And they respond in a way that makes it so clear that they get it. And then I don't hear from them for a long time, because I know that they're also struggling with the difficult emotions of feeling abandoned and feeling confused. So I think as birth professionals, holding space for both of those realities, it might just be a useful mindset.
I've heard you guys say it a couple times, and I might just not be familiar. What skill you're talking about specifically? Cope-ed?
Cope-ed. Jess, do you want to give a little summary?
Yeah, so it's the worksheet. Anjali, did you not get it? We can email it to you.
Okay.
But it's
email to the birth center.
I can forward it to her. Okay.
Anjali, it's very much like Tigers that we do in the Birthing from Within class, where you imagine what your fear is and face it, and then remember what your coping skills are, and and make lists of them or mentally drill it in.
Gotcha. Okay.
It's basically, you know, it's doing sort of like okay, this is the birth I don't want, when applied specifically to birth. You know, this is the birth I don't want. And actually, when somebody's sort of ready to do that, you know, encouraging somebody to, you know, imagine that is what happens, right? Imagining it in as much detail as they're willing to do, and imagining coping well with the birth they don't want using the skills they have. So, you know, it tends to really help, especially with trauma survivors, in approaching potentially triggering situations. Like, okay, I know I'm about to approach the situation and it's not what I wanted and I don't want to do it, but I have to. What do I do? How do I cope with that? So it's rehearsing ahead of time, coping well with that situation, going the worst way it reasonably could, basically.
And I just wanted to chime in. Thank you so much for hosting this. The other factor, Anjali, that I have taken into consideration when I have approached my trauma sensitive bodywork clients is to let them know that the measures are being put into place to protect them. And I feel like there's a lot of fear out there right now around people not wanting to be exposed. So I feel like it actually is going to be a comfort to the clients and patients that they are going to know that you are taking every measure to protect them. And that's what I've been focusing on when I approach clients and patients.
I love the comment, by the way, if people haven't seen the comment bar about adding a touch of humor to your masks, Anjali. I don't know if you're seeing the comment bar on the side, but, you know, clown noses, bunny ears, like, you know, a way to lighten it up.
I saw that. I'm going to think more creatively on that. I mean, having a nose or a bunny ear then again is another source of, you know, something to catch a virus and spread it. So, I mean, we're having to really slim down to what are the essential pieces of fabric or anything that we have on our bodies, right? So, but you know, we're of having coveralls sewn. So, you know, instead of having a disposable gown, because at the birth center, we're not going to be having anyone who's suspected with COVID or COVID. Those are going to be at the hospital and they will be fully gowned. But in the birth center, it's at this point impractical for me to have a disposable gown for every single birth. But if we have a disposable one that we will keep at the door, you know, we're thinking that could be made out of light-hearted, loving-looking fabric. But maybe even just some of the artwork up in the walls or the birth affirmations that we have. I'm going to think on that. Thank you. All of these are great suggestions and keep them coming.
Who else has a question or a
I have
comment?
a quick thing. Hello, Alicia. Hi.
Hi.
I'm newer in the field, but it's been really hard to see clients who, you know, you talk about autonomy and choices and things like that, and who we've been working through some of that. And now, you know, their care providers are, say, telling them, let's just do a C-section to get you in and out of there, or basically stripping their choices down to zero. And I would say most of them have gone into like a listlessness, or basically I guess whatever has to happen happens. And I don't know, you know, you said make it client led. I don't know if I should leave it there and say, okay, obviously I know I'm not going to have them, you know, chain themselves to their car doors or something. I mean, you know, but how much support can I provide there to not cause more trauma, I guess, that I know is coming? I don't know. Does that make sense?
That does make sense.
This is something that maybe Sarah can speak to first and I can add to, I'm thinking. What do you think, Sarah? About
this is really difficult. This is a really good question, and it's really difficult because I also have clients who are kind of going into that almost like a dissociation, this state of like, you know, I'm powerless. There's really nothing I can do, and I do feel like I've had that feeling that the more that I push resources, the more they turn away from me as their doula a little bit. So I think maybe one of the things is just focusing on their emotional state, because if they're not ready for you to give them suggestions, then that's not going to be helpful. But if you can identify exactly what is distressing them and have conversations that get to the heart of that, you might open up a potential conversation in which they are more willing to hear about their options, right? Because there are providers like the birth center and other midwifery groups that are having more trauma sensitive conversations just by nature of what they believe is important in terms of the care that they're providing women. So I like to remind my clients that there's a whole spectrum of providers in Atlanta, and that you might be receiving a certain kind of care because you're positioned somewhere along that spectrum. But yeah, I think getting to a place where hearing about changing providers is going to be helpful and not harmful is essential. Jess, what do you think?
So yeah, I want to just, that's great. And I want to echo some of what you're saying, that, you know, focusing on their emotional state, talking about that might give you a little bit more of like, well, I'm feeling this way, but I'm, because I feel like I don't really have a choice. So what can I do? And you might kind of be like, okay, well, it's up to you, it's up to you what you want to do next, and giving the information that Sarah was talking about. I wanted to add to this that, dissociation, or kind of a listless sort of like fine, whatever response, is actually usually protective. So if somebody's having a response like that, I may not be emphasizing their choices necessarily, because it's the reaction that we naturally have when we're pretty sure that we don't have any other choices, and that we just have to be ready for this to happen. And it is, if that is true, if there's a chance even that it's true, that they'll end up in a situation where they can't transfer their care, or they really don't get the birth they imagined, or, if there's a chance that what they're preparing for by kind of giving up does happen, then you've actually removed a coping mechanism from them by even, offering, well, maybe it doesn't have to be that way. So if somebody's really listless and not interested in their choices, I would really tread lightly, and maybe not, and maybe just let it ride that way for some folks. If, they're really like, yep, that's the way it's got to be, and that's, that this is what I'm preparing for, they may actually be less likely to be traumatized if they are, now it's exactly as I expected. Look, I had a C-section. That's what I was prepared to happen, and it happened. That may actually produce a better outcome for that person.
Thank you.
Anybody else have any comments or questions? These are really great.
Do you have any comments around the partners and the trauma and grief and loss that they might be either anticipating or feeling with, the possibility of not attending the birth of their child, or being separated from their baby? These are realities. So just curious to know if there's any suggestions or specific things we can be doing to support the partner.
Yeah, NICU parents being away from their NICU babies.
Jess, my first thought is this feels like a scope of practice to a therapist moment.
Yeah, I would agree with that. I mean, if it's somebody who, needs a little support, is a little concerned, you could, the COPA head skill would work across whatever you're approaching. So, if you're scared that this is going to happen, but you're not really overwhelmed by that fear, somebody might be able to use a COPA head skill. Like, okay, I imagine that happens, and how will I cope with it if that happens? And really kind of, as much as possible, viscerally imagining that. A partner could use the same exact skill. It applies across the board for, birthing people and partners, I would expect. But for somebody who's, really, for somebody that you're detecting is having a lot of anxiety or a lot of sadness, anticipatory grief or trauma around that, I would suggest a therapist referral in that case.
Is your caseload fairly flexible at this point? I wonder if you're getting an abundance of more appointments needed at this time. And is that, I'm just curious about you and other therapists who are specifically trained in trauma, like what your availability is. Cause I wonder about the overload even for you guys at this point, but everybody needs the help.
I'll just say social workers are equipped to do this as well, right? So if the hospital has a medical social worker, this is a great person to turn to who's already built into that system.
I do have some availability right now. I've opened my calendar more lately just because I've had some increased need, and so I can make myself available to a few more people right now, especially if they're dealing with these specific kinds of issues, which I have a heart for.
And I also have resources for low income support for mental health needs as well. Anybody else? We're just at our hour mark.
Anjali, I have a question for you. What's the policy now with birth attendants at the birth center as of today?
Sorry, you were just getting cut out. Your question was what?
What's the policy for birth attendants at the birth center today?
As of today, we are no more than 2 visitors and a doula. We're not recommending 2 visitors. We're recommending the minimum as possible, but whatever that mother, if she feels like there's 2 people that she really needs there, then we're supporting that as long as they are negatively screened, and we're screening everybody for any signs of illness, and then we're taking a temperature on everybody before they even enter the birth center. But just keeping in mind that if that ends up needing to be a transfer to the hospital, then we're going to have to go by hospital guidelines, which as of today is 1 visitor and 1 doula. That also have
heard that AMC is asking sometimes for proof of certification for doulas.
They're starting to. What I know Vanessa had suggested is, and I'm going to have to hop off the call for another hospital call actually, what she had suggested to the department was to consider using like a doula contract in lieu of like a certification card, because I know some doulas haven't kept up with their certification or never got certified. That doesn't mean that you're not a qualified doula. I mean, people have different opinions about that, but I feel like if you actually have a contract, then that shows that this is a service that you are, in contract with this client for. Okay, I gotta run. You guys, thank you so much.
Thank you, Anjali.
I had another question, and that was, if the transfer to the hospital happens and they have 1 partner, and so they're allowing a doula, but would that midwife be counted as that other person?
No, at Atlanta Birth Center. Oh, you're still on.
No, I'm talking about going to the hospital. Like, so a mother at the birth center who has a doula and a partner and a midwife. Usually the midwives go with the birther.
Yes. Yeah, for Atlanta Birth Center, at this moment, the midwife is still accompanying them, and we're the care provider, so we don't count in that birth, that visitor or doula. Okay, so Sam, you can answer any other further questions on the birth center, but love you guys. Bye.
Does that make sense, Gina?
Yes, it does, Samantha. Thank you.
We're the care provider still. Even if a physician is needed in that birth, we're still the primary care provider, so we don't count.
Okay, good.
That makes extra.
Sense. Well, you do count, but
well, yeah, like not in a negative way.
Any other questions? All right, we're gonna wrap up. Thank you so much, everybody, for being here. I didn't get any requests to not be included for updates on when we're gonna do our full training, so I'm gonna add everybody to Atlanta Birth Project's newsletter list. Thank you so much to everybody who made donations. It paid for the Zoom subscription in order to host this, so I'm so grateful. And keep doing the incredible work you guys are doing and taking care of yourself, all the while.
Thank you, Sarah and Jessica. Bye.
Thank you all. So nice to meet everyone.
Bye. Thank you.
Thanks, Sarah. Thanks, Jessica. Bye-bye.